Shanti.
Namaskar. We would like to welcome you all on our journey of brainstorming, knowledge sharing, and inspiring for next gen AYUSH SAMRIDDHI International Web Conference Series. Thank you for joining. I would like to welcome Professor Vishnu Prasad Sharma ji. Namaskar, Swagatam sir. I would like to welcome Dr. C.P. Sharma ji, all experts. We are fortunate our respected Madan sir has joined. Welcome sir. Welcome sir. So without wasting much time, I would like to communicate my sincere thanks to all the speakers, Dr. KCP Gunaratne, Dr. Rajeshwari, and Dr. Yashika from Homeopathy. Welcome to this platform, AYUSH SAMRIDDHI platform. I would like to welcome Dr. Vishnu Prasad Sharma ji for his initial blessings. Respected Vishnu Prasad Sharma ji.
Namaskar. Good evening to everybody. Respected Professor Madan Thangabhalaji, respected Professor V.K. Agnihotriji, respected Dr. Pawan Kumar Sharmaji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this evening webinar on AYUSH for stomach cancer, most important subject. And in this matter, Ayurveda shows very good result and can extend the lifespan of such type of patient. Today, we have eminent speaker, Dr. Wasika Arora Malhotra, consultant Homeo in Life Homeopathic Clinic from New Delhi. I welcome you. Next, I want to welcome Dr. Rajashree P.N., Professor, Department of Cellular Tantra, Amrita School of Ayurveda from Kollam. So I welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this evening webinar on important subject, AYUSH for stomach cancer. We have to spread this knowledge to the society that yes, AYUSH can show very good result regarding this disease and can extend the lifespan of such type of patient. So once again, I welcome all of you. Thank you. Namaskar. Over to Pawanji.
Thank you, sir. Thank you. I would like to welcome third speaker also, Dr. KCP Gunaratne ji from Sri Lanka. Unfortunately, her name was not in the flyer, but this will be on YouTube flyer and I have arranged it. So welcome Dr. Gunaratne ji. Welcome. Now I would like to request Madan sir for his initial blessings.
Pawanji, namaskar. Thank you so much.
Pranam, sir.
Agnihotra ji, pranam ji. Vishnu Prasad ji, namaskar.
Namaskar.
Namaskar. Thank you.
Pawanji,
thank you.
Namaskar, sir. Namaskar.
Namaskar ji, namaskar. Pawanji, thank you so much for bringing all of us together again and for a very important theme related to cancer. As Professor Vishnu Prasad ji has just said, there is a need for this message to go out into the community that Ayurveda can help. Not only Ayurveda, the entire AYUSH systems, Siddha medicine. We don't have our colleagues from the Siddha community here. We have earlier heard from them. Unani colleagues will also agree that there is much happening in that space. Yoga people in Bangalore, other locations also agree that there are certain things that certain aspects of AYUSH systems that will help cancer patients and cancer survivors. So there's another term called a cancer survivor, people who've been through some form of chemotherapy and then come out of cancer and then want to maintain good health so that they don't get recurrence of the problem. Now, in this context, I just want to share details. Some of our colleagues know about this already because I've shared these screens before. One is ongoing discussion between India and the United States of America with the National Cancer Institute. And I share this page once again. This is the National Cancer Institute, the Division of Cancer Treatment and Diagnosis of the Office of Cancer Complementary and Alternative Medicine, abbreviated as OCAM. And if you go into this web page, I will put this for those who are joining us in YouTube. I don't know if you can see, if you can just Google Office of Cancer Complementary Alternative Medicine or National Cancer Institute and Indian Medicine, then it'll come to this page. And for those who are joining us on Zoom, I will put this link on the chat box for you to follow through. If you go into this page, you will see several details of the discussions started quite some time back, and the collaboration areas. There are 6 or 7 points here, 6 points, and where there is some discussions going on. Now, there's not only this, of course, this initiative is taken by CCRAS, the Central Council for Research in Ayurvedic Sciences, but this is also for all the AYUSH systems. And in here, you will find webinars, recordings of previous meetings, thinking together a research-based dialogue between NCI OCAM and CCRAS. So if you go in here, you will see the webinars that have been held to date, and you can click on them and see the recordings. And you will see also the history of those interactions that have gone on. So that is point number 1. The second web page I wish to share with you people is the the meeting that is going to happen in Vagoli in Pune. And that is a very, very important center for Ayurveda and cancer. And the Vagoli Cancer Conference is coming up very shortly, the 6th International Conference on Ayurveda for Cancer. It is from the 9th, it's on the 9th, 10th, and 11th of December. So once again, for those joining us on YouTube, the web page you can access by just Googling Vagoli or Pune and integrative the Cancer Center, and you will see the details of the 6th International Conference on Ayurveda for Cancer. And you will also see the details of the different scientific sessions, 11 scientific sessions over 3 days. And you can also see the schedule in here, the schedule for the first day, second day, third day of the 6th Congress. Once again, I encourage all of you to look through the details and see if you can also attend the meeting. I'm still not sure whether information will be online. I think some of the sessions will be online. So, Pawanji, with those few words, I put the floor back to yourself so that you can take us into the program. Thank you very much.
Thank you for your communication, sir. Excellent communication and information. Thank you very much. I would like, before calling our first speaker, Yashika, I would like to request Professor V.K. Agnihotri, sir.
Agnihotri ji, pranam ji.
Yes, sir, pranam, sir, pranam, sir. Thank you so much, Dr. Pawan Sharma ji, and our regards to Professor Vandan ji, Professor V.P. Sharma sahab, and all the great dignitaries who have joined by now. And it's encouraging that today's starting, say, attendance is 29. It means the timing set for at 9 is...
That means time has to be changed. I have to sacrifice my sleep, sir.
Exactly. but the reality in positive way, we are getting starting number as 29, 25. It's much more encouraging, and I do hope that they will be increasing. So today's topic is
please
wonderful.
Change your routine also. I will change my routine also.
One may sleep off and on if time permits. Well, today's topic has been highlighted by Professor VP Sharma sir and again Professor Madan sir, that everybody has got a stomach. So stomach is to be taken care of, as our ahar is one of the upastambh of our Ayurvedic system of medicine. Whatever we eat, whatever we drink, it reaches to amashay, the stomach. So it is very, very important that the formation of all saptadhatus area of amashay, I mean the whole gastrointestinal tract is supposed to be very taken importance, and right things to be taken known as pathya. And if the apathya is taken, definitely it results in some other way. Of course, even the pathya sometimes, if it is not taken properly or ill combined with the other unfavorable condition, it leads to that. But as far as the stomach cancer is concerned, it leads from acidity to hyperacidity, then a peptic ulcer, and so on and so forth. So we are going to get more and more knowledge pertaining to the stomach cancer as such, and what the role of Ayurvedic system of medicine can play. Of course, Ayush medicine. So we are lucky enough that we are having one guest speaker from homeopathy. So it itself gives a good information that we will be going to have some other alternative if the allopathic is not working, if the Ayurveda is not up to the mark at the time, or even simultaneously if the doctors will permit. Homeopathic services can also be taken here. So we are eager enough to have lot of information. And thanks for the Bagoli Pune information regarding the cancer convention. So those who are interested, they may get the full voucher for that. And in this way, we will be having much more information from the Bagoli Center also. So thank you so much, or Dr. Pawan Sharma. Thank you.
Thank you. Thank you very much, sir. Now I would like to invite our first speaker of the day, Dr. Yashika. Welcome, Dr. Yashika ji. Welcome.
Thank you so much, sir. I am really thankful to Independent Research Ethics Society, AYUSH SAMRIDDHI, for giving me this opportunity to be at your platform. And before beginning, I would like to greet all our guests, all our dignitaries, all our organizers, Dr. Madan sir, Professor Dr. V.K. Agnihotri sir, Dr. Vishnu Prasad sir, my speakers, co-speakers, Dr. K.C.P. Gunarathne and Dr. Rajeshwari. So, and especially Dr. Pawan, who has been throughout. I have been disturbing him throughout. So thank you so much for organizing such a great series, and all covering all the topics which are actually necessary and the need of the hour to be promoted to the society. That yes, AYUSH. Now AYUSH, it's high time that AYUSH should be given importance, and AYUSH should be accepted by the people, that yes, it can cure so many diseases, because it has been prevalent not only in India. AYUSH has been prevalent all across the globe, and the drugs are usually the AYUSH drugs. Maybe it's Ayurveda, it's naturopathic, it's homeopathic, it's Siddha. So all are known to be better absorbed and utilized by the human body, and actually produce recovery without creating any adverse reactions. So before, without wasting any more time, I would like to start my session and presentation. So I'll be sharing my screen. I hope my screen is visible to all.
Thank you, Ji. Yes.
Thank you.
Thank you.
You so much. Thank you so much. Yeah. So my topic for today is stomach cancer, AYUSH for stomach cancer. How AYUSH has a good scope in managing the cases of stomach cancer. Though I'll be discussing the overall view of stomach cancer today and the role of AYUSH. But yes, being a homeopath, I am, as already said, that yes, I've joined today, and I'll be discussing and focusing what is my experience actually with stomach cancer. So I'll be focusing more on homeopathic management. and what is actually stomach cancer. As you all know that the AYUSH therapies, the advent of AYUSH therapies, when they came into the modern medicine and being accepted by the people for prevention of diseases, various treatments and usefulness, their effectiveness in various subclinical conditions, chronic disorders, like the lifestyle disorders, as well as the serious illnesses like this related to heart, related to cancer. So they have already shown their efficacy in upgrading the healthcare system. And they are very cost effective as well as known for their safety issues. So I think people are now accepting more towards coming to more towards the AYUSH system rather than preferring the allopathic system, especially after seeing so many side effects and whatever bad effects they create after the treatment. Especially if you talk about cancer, so we have chemotherapy, we have radiations, which influence the body more rather than curing. Actually, it deteriorates the condition of the body rather than leading to the actual cure. So stomach cancer, when you talk about, it is actually uncontrolled cell growth. Cancer is anything that is growing, that is when the abnormal cells grow in the body. So there is uncontrolled cell growth, especially in the inner lining of the stomach, and usually it is not being recognized in the early stage, like show symptoms like gastritis or normal acidity, ulcer. The symptoms are like the same, but actually it is the 5th leading type of cancer and the 3rd leading cause of death today globally. And around 7% of the cases of cancer come up as stomach cancer, and there are more than 9% of the deaths due to stomach cancer. And the most common stomach cancer, which is being seen in 90 to 95% of the affected people, is adenocarcinoma, which is actually present in the mucosa layer. Stomach cancer's treatment, when you talk about it, depends on the stage and location of the body, plus the cause. We guys focus being AYUSH, being holistic. We guys adopt a holistic approach when you talk about AYUSH, and cover the whole body, cover the whole individual when we are treating an individual for any case. Especially for cancer, if you talk, we take it as an individual, not just a case of cancer that we have to cure that patient. The chemotherapy and the surgeries, the gastrotomy, which is being done for stomach cancers, they are heavily painful, and which they may also lead, like we already discussed, barrenness and immunity low, or they may even create more cancers affecting the nearby areas if the stage is more pronounced. Usually, most commonly, the stomach cancer is seen in males, and because estrogen protects the woman against the development of this cancer, the hormone estrogen secretion, and most commonly it is seen in the people above 60 years of age, and very uncommon under the 40 years of age. And family history always matters. So the recurrent infections or H. pylori infections, smoking, heavy diet of meats, spicy foods, vegetables, pickles, etc., and tandoori foods, smoked foods, or obesity. These are some of the factors which actually promotes, or which actually may be a risk for developing cancer, stomach cancer. Genetic is always a cause, that if you have a family history of stomach cancer or cancer in the family, so you have more chances to develop cancer. When you deal with the case of stomach cancer, the patient comes to you maybe with the indigestion or some discomfort in the stomach, bloatedness, nausea, vomiting sensation, bhook nahi lagna, loss of appetite, jalan hona, burning in the chest. But when he goes to the advanced stage, He may also tell you कि मेरे को blood आ रहा है in the stools, that I'm bleeding and I have vomiting, I am complaining of weight loss, stomach pain, or jaundice, or ascites, that is fluid filled in the abdomen, or maybe he will have deglutition problem, trouble in swallowing. And there are some of the signs which are most commonly seen in stomach cancer, like edema may be present, or nodes may be present, anemia may be seen. These are some of the examination or diagnostic procedures which can be seen in a patient of stomach cancer. A hard lump may be felt in the abdomen. You can, if you suspect that patient is telling you a history of stomach cancer, or he may have stomach cancer when he's coming to your clinic or as a practitioner. So we go for barium meal X-ray. We go for abdominal CT scan and biopsy, gastric secretory test. These are some of the tests which are being done, our blood examination, especially the ESR and iron deficiency anemia. So these are some of the investigations which are most commonly done in the stomach cancer when he comes to us. And we always look for what we can do when a patient comes to us, either with a diagnosed case of stomach cancer, or he may be suspecting. So now comes the role of AYUSH, now comes the role of our system of the alternative systems of medicine, the complementary and alternative medicines. So what we can do as a homeopath, as an Ayurvedic practitioner, as a yoga therapist, as a Siddha practitioner, or as a Unani practitioner. We have some options that, first of all, we need to manage the case. We manage the case. We try to improve the immune function, the immunity of the patient, the overall functioning of his body, his quality of life. We should try to improve, and we should try that if he's undergoing chemotherapies, if he's undergoing many other therapies, then I try my level best to cope up with the side effects as well, so that the patient is not at disease, I would say, not at ease. He feels easy and he feels comfort. He's not at a discomfort zone. And also relieve his symptoms of the illness. Our first and foremost aim should be that we should try our level best to relieve his symptoms that are related to illness. When you talk about Ayurveda and cancer management, though I'm not an Ayurvedic practitioner, I've included this slide that yes, it can be used as a co-therapy. Similar goes with homeopathy as well, Unani as well. We can use it as an adjuvant or co-therapy along with chemotherapy or radiotherapy or post-surgery care. And we should minimize the side effects, reduce the therapeutic dose of the other medicines, heavy medications that are being given to the patient, and target the specific tissues. Which are being affected. It also helps to slow the progress of cancer and prevent the patient or increase his lifespan, we can say. Anti-tumor action you can give with the various Ayurvedic medicines. Like when I was preparing the presentation, and I was going through some of the medicines and some of the things that are being given, herbal medicines are being given to provide cancer treatment. Like one I was going through, that Punarjan Ayurveda, that is being given. Like Ayurveda follows with Kapha and Pitta dosh to cure cancer, which is based on the patient's physical as well as mental status. So they give medicine that are herbal and that won't cause any side effects, plus help people to live more ages. I would say they enhance the lifespan of the patient, plus improve the quality of life also. When you talk about homeopathy, being a homeopathic practitioner, I can clearly say that yes, I have seen cures. I have seen patient recovering sooner than any other alternative therapy or any other modern medicine as well. Because we consider that cancer is actually the result of some or the other disorder. it is actually a disorder, and we should turn it into an order and heal it, cure it from the core. That is the root or cause of the disease. We have if you go through a homeopathic history, we have Dr. J.T. Kent, one of our stalwarts, homeopathic stalwarts. He said that when you're thinking of remedies for cancer, we get confused. But whatever cancer it is, we get confused. But we should always think that the patient is appears to have cancer is orderly. The remedies which we are going to choose, that should be in order. And if you choose medicine corresponding to the conditions, we will cure, because homeopathy works on individualization. That is, we see the individual and give the remedy. And whatever is curable, whatever is capable of change, that will be better by effective administration of medicines. So we choose the medicine, we choose the similar remedy to manage the pathological case of stomach cancer. We have numerous remedies. With remedy discussions, I'll be going to discuss few of the results which I have seen. We have numerous remedies, thousands of remedies, which have different symptoms that may be helpful in different cases of stomach cancer. But if we justify few that are most commonly used and are very effective, I have summarized a few. We have some remedies like acetic acid. I have seen a case which came to me around a year back. She was complaining of she was a diagnosed case of stomach cancer, and she already had chemo and was coming to the nearby doctor for injections, regular injections that are given in chemotherapy. So she visited me and came to me with the just was talking to me that if we have any treatment. So we had a discussion about the case. She was complaining of nausea, vomiting, weakness in body, and she cannot get up. She was having edema as well. She was very swollen. The body was very swollen, and we discussed the case further because she was interested and she had a good belief that yes, if I'll get some benefit from any of the other medicines, so it would be helpful for me. She said that she used to face a violent pain in the stomach and chest whenever she had something or food. She used to feel inside that she has a lot of burning in the abdomen. So if you talk about our first remedy, acetic acid, I was going through the case. I asked her about her thirst. I asked her about the weakness that she's feeling, the dropsy, the edema which is occurring in her body. She was a diagnosed case of cancer, and she said that she used to vomit recurrent after eating anything, and there was some tenderness, pain which was present in the body, plus eructations she had. She used to have profuse saliva from her mouth, usually used to occur especially while sleeping. So, and violent burning pain in the stomach. So all these complaints, all these things which were being discussed during the case taking with her. So I just ruled out one of the very common remedies, that is acetic acid. And it was given to her, like we give a very minimum dose to the patient. It was given to her once a day for 3 days in lower potency, 30 potency, because 30, this is our scale. If we can if we'll have regular webinars, or we'll be thinking about educating people more about homeopathy, we can discuss what is actually the case and what is actually potencies, what is actually the things. So what is actually homeopathy, how it works. So we can discuss it further when we have good enough time to discuss the expanded view of homeopathy. But yes, that patient was given acetic acid. She came to me after a week, telling her that she's better, she's feeling a little better, the weakness is better, and the vomiting is better, the pain is little better, but only slight improvement was there, 5 to 10%. The medicines were repeated again for the week because she had some improvement, but there was a wait and watch that now the improvement has stopped. So the medicines were repeated, and within 2 months of span, 2 months of time, she was very happy, and she was very better, because with the tenderness, with the vomiting, with the pain, and her symptoms improved. She was feeling better inside. Then slowly the treatment was carried on, and now she's better. But yes, I can say that the cancer is not cured, yes, but her lifespan, but her lifestyle has much improved, and she's actually happy right now. So managing the person along with alternative medicine is like very, very, very which can be, as said, it can be used as a standalone option or as an adjunct, you can say. Now she has more belief on homeopathy rather than going for any other alternate, going for chemo and always running behind. We have more medicines like conium maculatum when there is ulceration, cancer of stomach, hardness which is seen in the abdomen. We commonly use this again remedy, Lobelia arenus, for especially for colloid cancer of omentum, when the patient is having pains, very, very sharp pains. We have a remedy made from snake that is Crotalus horridus. That is a wonderful remedy which has helped me a lot in various cancer cases, treating various cancer cases, as well as cases related to malignant growths or benign growths, wherein the patient complained of vomiting of bloody mucus, because a remedy which is made from snake, we believe it as the symptoms which it shows is like bleeding tendency is shown by the few snake remedies. So when the patient is complaining of vomiting of blood, so Crotalus is a great remedy. Condurango again is a very good remedy which is very helpful, which has given great results in stomach cancer cases. And Graphitis, which is again for growths, for any type of malignant growths in the body. These medicines are useful. Phosphorus ornithogalum umbellatum, which has shown a great result when the patient is not getting relieved by any other medicine. These medicines act great. So being a AYUSH practitioner, being a layman as well, I would say, whenever you're going out, you should not always opt for the easy option that will give you immediate relief. Yes, you should go for something which would give you a better and a lifelong relief, actually. So being a layman, being a person, why you can opt for AYUSH and homeopathy, because especially homeopathy, because they actually play a vital role and a curative treatment, provide you a curative treatment for all the chronic diseases, especially cancer, dealing with cancer cases, especially stomach cancer. Because we opt for a gentle and curative treatment, a gentle healing. We give a gentle healing to the sufferer, and I believe that yes, people are now opting for better. People come to us with various cases and various critical conditions that yes, I am now badly at a bad situation, please help me out. So yes, we have the ability, AYUSH has this ability to cure the patient, especially of stomach cancers, and treat them, manage them, make their life long. And as per our theory, as per our belief, that we believe in Sora psychosis and syphilis miasms, Ayurveda believes in Vat, Pitta, Kapha. Similarly, yoga, Unani, each of the system has some or the other benefit which can help to cure, manage the pathological changes that has occurred in the body. So thank you so much for this is all my part. We can have more discussions. There is a lot to talk about, many things, cases, discussions, showing reports, evidences, because it is actually the evidence-based medicine. If we make AYUSH an evidence-based medicine, if we make each and every aspect of AYUSH as an evidence-based and show it to the society globally, yes, then it will be accepted. So thank you so much. I hope I could give a good message and something you could take from this presentation. For any queries, you can mail me at this given email ID or WhatsApp me at this number. Thank you so much. Thank you, Independent Research Ethics Society, for this for giving me this opportunity. Thank you, sir. Over to you.
Thank you very much, Yashika. Thank you very much. Very nice explanation regarding homeopathy. It is definitely a good and a new line for us, and we are learning from experts like you. Welcome. Thank you very much. Now I would like to request Dr. Rajeshwari and Dr. Rajeshwari ji. Welcome.
Yes, sir. Thank you.
She is head of the department in Coimbatore Ayurvedic Medical College. Welcome. Welcome. Kollam, sorry, Kollam.
Okay. Hope my slides are visible.
Yes, very clear.
Okay. Good evening, everyone. Special respects to Pavan sir, Madan sir, and Agnihotri sir. On this month of November, we usually give more importance to awareness related to the stomach cancer. So in this regard, it's my very initial attempt, or a very small attempt, like a baby steps in the management of stomach cancer and unique remedies in AYUSH. When we go back to the history, we'll be having some of the references where great ruler Napoleon was also having a condition called as gastric ulcer, which was later proved by the medical professionals, saying that or they were in search of the causes for the stomach cancer, gastric cancer. They could publish some of the papers related to the exposure to higher concentrations of essential oils and his food habits, lifestyle, everything had contributed to the gastric cancer. So in total, this story says us about the exposure to the chemicals and altered food habits, which are not conducive to one's health, is going to end up with gastric cancer. So the most of the descriptions of Dr. Yashika was similar to me in the introductory part. So I would just focus on as a clinician, how we have to begin our journey in the management of stomach cancer. As we know, among the most of the CA conditions, stomach CA is considered to be one of the major causes for the mortality worldwide. And as I told earlier, it is because of the food habits from one place to other, where they are used to certain kinds of foods which are not good for the human gut, and that may be the probable cause for the increase in the rate of stomach cancer globally. And we have another cause where this disease condition runs in the family. And also there is a contribution or affinity for one particular blood groups. Like textbook says that blood group A is mostly affected by stomach cancers. And when we say its incidence and prevalence, it's the fourth most common cancer in the world and second most common cause of the cancer related to death. Why it becomes so dreadful to the patients, or why it is most challenging to the clinicians, is it is a silent killer, because initially there is no description, evident symptoms will be exhibited by the patient, where the patient also neglects his illness, and doctor also thinks that it may be a simple illness related to the gastroesophageal reflux diseases. So stomach cancer is, when we hear this word stomach cancer or gastric CA, when we get the reports or when the patient gets diagnosed, the most important types we have to focus is, one is ulcerative type, another one is a proliferative type. So the proliferative type, most of the times they need a surgical intervention in the beginning itself, whereas the ulcerative type, we can diagnose and we can just give a kind of palliative treatments, because there may be, initially there will be less scope for the surgical intervention. When there is a metastasis, when it enters all the layers of the stomach, they'll go for a surgical interventions. So why this picture becomes the most important for all of us to remember is, the antral part of the stomach is the most susceptible part compared to the cardiac part. So the antral pyloric antrum is a distal part which is having a connection with the intestine, because that is the next part is a duodenum, whereas the less is related to the esophagus. So that part is less prone for the CA conditions. Whereas the majority of the parts is occupied by the body of the stomach. If we look in detail, or if we look at very minutely, these two areas are most prone for all inflammatory diseases of stomach. It's one is a body, another one is a pylorus, where the maximum incidence or maximum occurrence of a peptic ulcer or gastric ulcer happens in this area. So this will be the basic cause for the future onset of CA of stomach. So that point we must remember as a clinicians. And we know that another one report we'll get every time when the patient go for an upper GIT endoscopy, and they'll come up with a biopsy report saying that Helicobacter pylori is positive, Helicobacter pylori is negative. This is a mandatory investigation they'll perform along with the upper GIT endoscopies. Why the medical community is so much keen to go for this is, this Helicobacter pylori infection is nearly causing like 3 to 6 times increase the risk of gastric cancer. So here we have to remember, once this patient is having a Helicobacter pylori, it's our responsibility to give an awareness about his illness. We must ask him to change his diet, etc. So we have to, once this condition is diagnosed, the left picture depicts, these are the questions a doctor need to ask to that particular patient about a diet, about the smoking habits, and we must give ample importance for any surgical procedures he has undergone previously or not, whether the gender is going to contribute here or not, whether age is, what is the age of the patient. If a patient is at 30s, we may not worry much. Once he is in the 5th or 6th decade of life, yes, our responsibility increases. And obviously our responsibility is doubled when there is a family history, and if he is having a underlying medical conditions. Because as I am staying in a coastal area, we are having an inflammatory markers will be high in this area. So medical conditions related to the elevated serum Ig immunoglobulin levels or eosinophilia conditions will be maximum. So it's our duty to take an extra history from such patients where we are suspecting these are the susceptible groups where in future they are going to get some of the serious illnesses, though it looks very minor at present. So before we start our treatment, we must understand what exactly is a mechanism is happening in the gastric mucosa. It's a very simple mechanism which is altered because there is a pH alterations, there is a mucosal alterations which happens in the stomach because of the vitamin C deficiencies, or whether if the patient is taking a high salt diet, or it is also contributed by H. pylori infection, which secretes more and more amount of HCl. So because of this, that the first and foremost symptom occurs in a patient is the inflammation of the gastric mucosa. So this is an alarm for all of us because most of us treat these cases. And once this mucosal inflammation starts, over a time, if patient is not receiving the best treatments, the metaplasia starts. One form of the cell is replaced by other forms of cells, like columnar epithelium of the stomach will be invaded by the mucosal lining of the intestine, or from the squamous epithelium of the esophagus. So this kind of transitional zone happens, and most of us come to us in this. And if we are little bit involved in the history taking or patient's clinical presentations, we can identify this stage of the stomach cancer. So this is the best stage for all Ayurveda physicians to treat the cases, because most of our medicines, which we discuss in further slides, are having an absolute relief. They are giving an absolute relief to the patient. So the understanding the stage, understanding the mechanism of injury which is happening to the gastric mucosa, and how the invasion of one type of cell is happening over the other type of cell. That's what they are telling. Metaplasia or dysplasia is going to happen there. So once this metaplasia and dysplasia happens, the patient is prone for the malignancies or cancer conditions. Okay, so what will be the alarming symptoms? And we know every day we treat nearly 20-30 patients who are simply coming with other illnesses and just giving a statement that there is a abdominal discomfort, there is a weight loss, so there is a poor appetite, there is a nausea, there is fatigue is there, and most of them ladies are suffering from anemia and all. So when we are living in a what do you call the stomach cancer prone area, certain districts or certain places are very prone to this kind of diseases. When we are living, when we are treating, when we are exposed to such kind of patients, most of the complaints told by the patients must not be taken very lightly, where a poor appetite is the only one preliminary symptom we get in a gastric CA. If we are not recognizing it, or if you are not diagnosing in that stage, it is going to lead into a metastatic phases. So each and every symptoms, like if a patient is having a poor appetite and this diffuse discomfort in the abdomen, we are always one point we'll consider is it's because of gastric ulcer. Another point we consider it is because of the liver diseases. Meantime, if based on the age of the patient, we also must suspect about the gastric cancer also. So this must be our responsibility related to the awareness of stomach cancer in the people. So there are a few more predisposing factors like lack of vitamin A and vitamin C. We know that vitamin A is required for the complete health of the epithelium. So once this is in scarce, there will be desquamation happens. So the entire epithelium of the gut can get damaged. And vitamin C is also playing a major role in almost all the immune related activities. Hence, this is also when there is a lack of vitamin C, there will be all antigen antibody reactions automatically happens, and autoimmune diseases are more. And alcohol consumption may be there. Or the one susceptible group is the people who have undergone gastric surgeries for any benign diseases. scar formations, cicatrizations, or any injuries, previous trauma can exacerbate the conditions of gastric cilia. So that particular history we must take. So these are the clinical set of clinical symptoms we get, and there are these must be classified as early symptoms and later symptoms also. When we just look into the early symptoms, there is a complete heartburn or bloating. These are looks like they are in some other digestive issues also. They are not looking as very specific to the gastric ulcer. So this will be an alarming point for us to identify the cases. And the stages of stomach cancer. When we look into this picture, there is a minor invasion in the mucosal layer, submucosal layer. Whenever there is this kind of lesions, it's easy for us to manage. Whereas once it goes to stage 2, 3, and 4, there may be the possibility of integration is more there compared to the standalone Ayurveda treatments. So the stage 1 is quite convincing for all of us. So we can do these treatments with our medicines, and we can convince the patient also. But in other stages, we must not take the risk, as it is invaded into all the layers of the stomach. And in stage 4, the metastasis also occurs. So if we want to give a treatment at this stage, we can only give the treatments for the complications that happens for all the treatments, like chemotherapy complications or radiotherapy complications. We can contribute as an add-on therapy treatments or add-on therapies at that stage. So we have all the facilities like examination to investigation, and CT scan is there, biopsy, and exfoliative cytology. So nowadays, exfoliative cytology is considered to be the most important to diagnose if the condition is not showing as much as clinical symptoms. And with that, I'll just explain some of the conditions, how we can deal with the Ayurveda treatments. So this is a common condition where it occurs as a complication of gastric ulcer. But the lesion is not in the stomach, but it is in the lower end of the stomach. And the predisposing factor is lax lower esophageal sphincter. The gastric contents are constantly irritating the epithelium, squamous cell epithelium of the lower end of esophagus. So what happens is the columnar epithelium of stomach is dragged into the lower end of esophagus. The most of the patients who will be coming to us will be in this stage, Barrett's esophagus stage. Even luckily, we have encountered few patients where the stage was not, it is actually a benign and pre-malignant. It's considered as a pre-malignant condition. But if that stage is not treated, we are going to get the actual condition of stomach cilia. So this is the area where we can treat with our medications. So this, and what will be the, what are the points we have to consider before taking up this condition is, we have to look into all these points. It is lax LES is there, whether GERD is there, whether mucosal erosions are there, Barrett esophagus is there. And with that, we have to decide what kind of treatment must be given, which dosha must be addressed there, which are the medications to be selected, and the medication in which form, whether you are giving in an alcoholic extract, whether you are giving in a water extract, or whether you are giving in any kind of powders or tablets. So I would prefer that there is a very small reference for the treatment of gastric ulcers. This is one example I have told. Initially, whenever the patient comes to us with all the treatments, Ayurveda treatment starts with Amapachan, then comes a Shamana Chikitsa, then comes a Shodhana, and Shodhana comes first, but in this case, we cannot directly go for a Shodhana Chikitsa. So Shamana will come first, then we can, it's a yukti, or it is the logic of the physician to adopt when to adopt the Shodhana Chikitsa or purificatory therapies. And lastly, it comes a Rasayana therapies, or treatments which heals or which is going to recover the stage of illness. So this is a common protocol we use in almost all the gastric diseases, especially for gastric ulcer and also for gastric celiac. Whenever Barrett esophagus condition comes, we'll be starting with, first we try to correct the digestion of the patient. Then the digestion of these are the medicines which are given in very small doses, not dumped like 3 teaspoon, 4 teaspoon. This Hingostaka Churna, what we give is hardly 1/4 teaspoon is given 4 or 5 times a daily, just to enhance his Agni. And once he is once he can withstand the treatment, then the dose will be increased. Next comes the Shamana Chikitsa. Based on the major complications or major symptoms, what he is telling, based on that, we can plan some of the medicines. Dhanvantaram. So this is a one which reduces the acid secretion also, and the one which is decreasing the bloating, loss of appetite, etc. symptoms. So we have given a very small dose, like these tablets are very small. 2 tablets you can advise with the warm water or with the cumin water also. Next comes the This is it's like a probiotic for the gut flora. So this is also advised. Then once the patient is stable, we are planning for an Shodhana, that is purificatory therapies. After purificatory therapy, it's not given as a traditional way. Lots of ghee will not be given to the patient. Patient may not be susceptible at that stage. So we are giving it a daily small dose, and even the Shodhana is also done on daily basis. Then followed by Ropana. That is, usually if it is an ulcerative type, we'll go for a Dadimadhyakrita. And if it is proliferative type, it is out of our hands, we'll not go with that. So that's why the treatment principle can summarize in this way, what exactly we need and how exactly we have to plan the management. This is how, well, only one medicine for 2 weeks, and the medicine is for another 2 weeks, and third one is for another 2 weeks, and one Shodhana is for another 7 days. This is not like give a medicine, send the patient and call back after 1 month. We must monitor them periodically. So the gold standard treatment, what I suggest is the Yashti Madhu Kshirapak, that is Glycyrrhiza glabra, is boiled with milk and can be given in 100 ml daily. So this is the most successful treatment we could get for all gastroesophageal reflux diseases, along with Barrett's esophagus. So this treatment goes for 1 month to 2 months, maximum 3 months. Only 3 grams per day is used, because that is a maximum dose we can give. This licorice powder per day dose is 3 grams. So that 3 grams is boiled with 1 glass of water and 1 glass of milk, reduced to 1 glass, and you ask the patient to consume. So all the irritations which are there from the oral cavity to the throat and to the esophagus and lower end of the esophagus and also stomach, everything is going to decrease with that. So that is a promising results, and papers also shows that Glycyrrhiza glabra is having a anti-H. pylori property. So we can use it, we can club it along with other treatments for the gastric ulcer. Another point which we suggest is, like if it is in the pylorus or antrum part, the intestinal health is mostly contributing for the stomach CA. So in that condition, we have to take some of the medicines or recipes from the Grahani Chikitsa. Okay, so this is from the where Yogaratnakara says about the use of buttermilk. And I would suggest that not only a simple buttermilk, this particular drug, oxalis corniculata, is 20 ml of its juice is taken, mixed with buttermilk, and you can give. Because there is a direct reference in the Bhava Prakasha saying that this can be given as a food rather than a medicine. So with that, I think clinical description and the theoretical description, how we can understand is, this is the most important paper which was published very long back, long in 2015, where they are how they have interpreted the understanding of cancer in Ayurveda. So we don't get a single chapter where all types of cancers are explained. Instead, we are getting a different chapters along with the different stages, and they may not be of a tumor origin. There are non-tumor origin also, and the descriptions are not available in a single chapter or single section. It is present in almost at the end of every diseases. So with this, the author is telling that when we start giving a treatment to a malignancy, do not consider only the chapter of Arbuda, which is told in classics. Instead, you learn or you understand how the description of a particular illness or description of a clinical symptom is explained in other areas also. So based on that, we must frame a treatment protocol. That's why we are not getting a ready treatment protocol in most of the malignancies, because every doctor will form his own points. So with this base, I will say that this is another paper which was very much interested, and we can get completely, it's like an eye opener for all of us, where the understanding of malignancies in Ayurveda must go in this order. So this article is published in PubMed, where the PubMed ID I have given at the end, where the author is still listing out chronic inflammatory diseases and its relation with the neoplasms. So when we look into the whole chapter of malignancy, the most of the conditions are associated with the chronic inflammatory conditions in the beginning. Later, it turns into a neoplasm. So he he has a long list of diseases. I have noted one or two where we can see the hepatitis leading to hepatocellular carcinoma, and in the same way, gastritis leading to gastric adenoma, and the organism is Helicobacter pylori, whereas he gives chronic pancreatitis leading to pancreatic carcinoma, skin inflammation giving to melanoma, reflux esophagitis leading to Barrett's esophagus leading to esophageal carcinoma. So this was an eye-opener for all of us, and along with that, this particular article. So this is a documentary which was published recently as a short communication from the research head of our institution, Dr. Ramanohar, where he has collected all the research documents of this particular doctor, that is Dr. C.P. Matthew, who was a first medical oncologist of Kerala. So when we see his prescription or his understanding of treating malignancies with Ayurveda medicines, I have given a list of all the medicines in the second column. You can see it's Triphala Churna is there, Shiva Guliga is there, Shilajatu Rasayana, Guggulu Rasayanas, then Siddha Makaradwaja. See, all are having a basic quality like anti-inflammatory. So this is a trusted information, because Dr. C.P. Matthew is a pioneer of integrated oncology, where we can get an idea and we can start our research based on this, where the most of the conditions of malignancy he had addressed under the common umbrella of chronic inflammatory diseases in the beginning. And those who really need an radiotherapy, he has advised. Where the patient really needs an surgery, he has advised. And where there is an active inflammatory phases going on, he has combined chemotherapy along with the Ayurveda. So this is a understanding given to us by Dr. C.P. Matthew, where he has clubbed the pathology of oncology, pathology of all the malignancies explained in the oncology books, along with Ayurvedic understanding, because we don't get a chapter like there is a stomach CA in Ayurveda. So he has understood and he has found out how these medicines are working. So when we look into this prescription, this is the core idea of this prescription is anti-inflammatory. So I would say that this particular principle even works, especially the Shivagulika and Shilajatu Rasayana and also Triphala Churna. We have seen when I was studying also, the people, senior doctors were using this in most of the skin cancers and also in most of the colonic and also gastric cancers. So 1 or 2 drugs they used to keep and they used to repeat the prescriptions, so that the basic idea was only to reduce the inflammation. And in my experience, I have only with the Vardhamana Pippali and Amalaki Rasayana. These are the different types of antioxidant therapies which are explained in our text, which is for complicated conditions. Whenever a disease related to liver comes, go for this Pippali Rasayana. Whenever there is diseases which are related to immune system, we can go with the Amalaki Rasayanas. If the diseases of urinary system or malignancies are there, Shilajatu is the best. Skin diseases, again, Ashtimadu is best. And Guggulu Rasayanas, in some people are using even in hepatocellular carcinoma also, and in lung carcinoma also. But I have only observed Vardhamana Pippali Rasayana is having a good impact on the in the initial stages, like if there is a cyst in the liver, if there is a benign growth in the liver, where they'll come up with a report saying that an echoic area is found. It is it's suggestive of some kind of nodule in the liver. In that stage also, if you are starting Vardhamana Pippali, it is helpful. Amalaki Rasayana mostly applied in all cancer survivors also, and to give as in boosting for their general health. And it is a rich supplement of vitamin C. So most of the gastric irritations or mouth ulcers or gum ulcers, everything, because it happens due to radiation and chemotherapy, can be minimized. Even Ashtimadu is also given in oral gargling, for the used as a gargling, and also as a local application in case of mouth ulcers which are induced because of chemotherapy or radiotherapies. So with that information, I just conclude with only one statement. Most of us must start with studying. We have to start from today. Again, we have to study, telling that the chronic inflammation is also one of the factors which are contributing for the progression of tumors. And once we address in this mechanism, I think we can be successful in providing an integrated approach, or in minor conditions, we can become a standalone therapy treatment system in case of stomach cancer, as it is related to the food habits, as it is related to the microbiota. The proper awareness, proper judging, and utilizing the single herbs which are explained in our Ayurveda can be much more helpful in reducing the progression of illness, and it also paves the path for building a healthier society. With this, I just thank all of you for giving me an opportunity to share my views in this occasion. Thank you, sir. Thank you, Pawan sir, for everything.
Thank you. Thank you very much, doctor. Thank you very much. Excellent. Now I would like to request Dr. KCP Gunaratne ji. Welcome. Priyadarshini ji, welcome. Welcome. Thank you, Dr. Rajeshwari ji.
Thank you, sir. Thank you, sir.
Yes.
Rajeshwari ji, I hope you will stay with us for the
Definitely,
question.
every speaker will stay, sir.
Yes,
Don't
sir.
worry, every speaker will stay till end.
Yes, sir.
I have
Sure.
requested all, and I am requesting all except superstar. Welcome, Ayubavan, madam.
I want, sir,
Hello.
respected dignitaries. Now I am going to present my presentation. Actually, previous madams, they have very nicely explained a lot of things. Still, I have to more simple things. That's why I am going to present this way, that Nidana Rupa examination, investigation, Chikitsa, Patya, such things. And what early madam said, that all correct. I want to tell one thing, nearly 1 million new cases annually detected with gastric cancers, and 0.7 million deaths due to gastric cancers annually. Then what are the common factors? I think madam all explained. I want to add a few things. Actually, in old age, it is very common, and that males having more prevalence than females, and especially because of their diet. Because we all know that GIT tract or the Annavaha Shrotas is directly communicate with diet. So because of our incorrect diet, it will lead to gastric cancers. Then other one is occupational exposure, some fumes and dust. Because of that also, it will lead to cancers. Especially I have to tell, obesity also a cause of cancer. Then specific factors also madam said, and according to my experience also, some are having prolonged gastritis. They may be leads to cancers later, and especially smokers. Then prolonged polyps. Some are coming with prolonged polyps in their stomach. And recently also I have 2-3 patients. They having strong family history of cancers, especially in GIT tract. Now other members, they have detected with gastric cancers later. And other thing is that high salty and smoked foods taking, what I have previously talked. Then what are the signs and symptoms? Mostly they are coming with bloating abdomen. Sometimes they are coming with anorexia, loss of appetite, bowel problems, especially constipation. Sometimes they have loose stools. Sometimes they are coming with blacky stools. Likewise, sometimes they are having discomfort of the abdomen and pain of the abdomen. Sometimes they are experience with some stomach swollen or something. Likewise, they will come to us at that time. So actually, in my view, normally I am considering mostly with Arbuda Chikitsa and the Granthi Chikitsa. So I have given that Samprapti, according to that, vitiated dosha, mostly kapha affected dhatus. Then vitiation of Mansa, Rakta and Medas. Then abnormal vitiation of dosha and dusha, followed by their accumulation at the one place. It has protuberance like joint of bamboos, joint between two parts of plants or kernel of fruits of amalaki, and it's relatively hard and rough in touch. So while we are considering about the chikitsa, first we have to go for the Samprapti Ghataka. So as Samprapti Ghataka, dosha is Vata Kapha, then dusha mostly Rasa, Rakta and Mamsa, Shrotas, Andamaha Shrotas, sometimes associated other Shrotas also while metastasizing started. Then Shroto Dushti, Sangha and Atipravrutti, Roga Marga, mostly Abhyantara, then Udbhavasthana, Amasha and other parts of the GIT. Then what kind of types of cancers we can see? Adenocarcinoma, gastrointestinal stoma tumors, carcinoid tumors, and lymphomas. Then what kind of complications? Sometimes some patients coming with symptoms or pre-symptoms, but sometimes some patients coming with the complications. What that they are telling, lump of the stomach, ascites, what I told earlier also, blood in stools, feeling tired or weakness, anemic, likewise. Then we have to ask some investigations, because some patients are already they are coming with the early diagnosis, but some are coming with all these symptoms or the complications. At that time, we have to go for the investigations. So we have to ask endoscopy, especially upper part of the intestine, then gastrointescopy, barium solo, CT scans, bone scans, so see the metastasis, then MRI, then biopsy, then PET, ultrasound scans, and X-rays. So again, we have to see the tumor markers, especially for the stomach cancers. We can ask for CEA, the tumor markers. Then what kind of aims and in the Ayurveda management? We have to see the reduce the size of the cancer cells, because the cells are growing very rapidly, and shrink the tumor, then prevent further spreading and minimize the complications, then manage signs and symptoms and enhance the quality of life. So what kind of management we can do? We have to first identify the nidana for the specific patient individually, what are the causes. So we have to identify and do the nidana parivarjana. Then we have to give the ideas and the instructions about the ahara and vihara, then aushadha, then anushastra karma and the shastra karma if needed. Then what kind of nidana parivarjana we can do? We have to give the instructions for prevent from harmful radiations and chemicals. Then mostly that mental factor also affect on the cancers. So we have to ask them to prevent from the mental factors, and they have to prevent from apatyahara and vihara, special addictions, maybe smoking, maybe betel chewing, such things, and apatya aushadha, maybe they're having some kind of medicines, they all lead to stomach cancers while they are taking prolonged. So in treatment aspect, what we can do in Vaisajya Chikitsa, that means without surgical treatments, what kind of medications we can give. In Abhyantara, as previous madam told, we have to do Shodhana, Virechana, Basti, Vamana, Raktamokshana, according to the patient's situation, patient's prakriti, and we have to consider a lot of factors. Then Shamana, at that time, we have to do Amapachana, Agni Deepana, Shoto Shodhana, Ojo Vurdikara, and Rasayana. Then Bahya Chikitsa means that the local treatments, what we have to do, sometimes we have to ask the patient to do Svedana, some kind of Lepana, Panaha, Pachana, Vimlapana, etc. Then we have to do the support treatments also, because that is not only that previous madam told, it is not only Arbuda or Granthi Chikitsa, not only inflammatory problems, but it's a combination of reasons or the causes leads to that cancer. So we have to do the other supportive treatments also, Shotahara treatment, then Granthi Hara, then Lekana, then yoga, breathing techniques, the relaxation techniques, and meditation techniques even. Then what kind of aushadha we can give? We have to give that aushadha also according to the patient's age, stage of the cancer, then the prakriti of the patient. Then we have to decide the dosage even according to the situation. So as Vata Shamana and Vata Anulomana or Shulahara, we can use Dashamula Kasaya, Dantimula Kasaya, then Yoga Raja Gugulu, Vata Gajendra Singha, Narayana Taila Matra Basti, then Nirgundi Taila local application. Then as Grantihara, we can use Varuna Kashaya, Kanchanara Guguluvati, Chandra Prabhavati. Then as Shotahara, we can use Punarnamashtaka Kashaya, Kaishora Gugulu, and Dashanga Lepa. Then we can do that Amapachana and Agnidipana with Dane Panchaka Kashaya, Bilvadi Kasaya, Pancha Tikta Kashaya, Panchakola Phanta, Agnitundi Vati, Ingwashtaka Churna, avipattikara churna. And that virechana, first, according to that patient's condition, sometimes they are having very discomfort of their abdomen. So we have to use nitya virechana for such patients. So we can use Trivutadi Kashaya, Tripaladi Kashaya, Tripala Churna, Manibhadra Churna, Datri Churna, Sukumara Churna. Actually, here mostly we are doing palliative treatments. So we have to see the all aspect of the patients, and we have to see with all angles. So while we are treating, especially we have to see the kapahara chikitsa also, because all granthis and arbudas making with kapha. So we have to do that kapahara chikitsa with darukarpata kashaya, sitophala churna, talisadi churna, sharkaradi kalka, buddharaja kalka, etc. And rasayana, especially that weak patients, we have to do that rasayana. If not, while they are taking other allopathic medicines, sometimes with radiation and chemotherapy, at that time, we have to do the side support with rasayana therapy. That means with chavana prashava, pushmandaleha, haridra khanda, tripala churna, ashwagandha rasayana, etc. So, prevention from stomach cancers, what they have to do to prevent the stomach cancers, because prevention is better than cure always. So without suffering that much, we can prevent actually. So we have to do some prevention aspects. So they have to do early treatments, especially for gastric reflux and gastritis, etc. Especially that stomach infections, what Madam told earlier, and polyps in the stomach. Then high intake of vegetable and fruits, that also prevent gastric cancers. Then less intake of salty and smoked foods. Then stop or control smoking. Then screening early when family history of cancers. Because already I am having one patient, he is around 33 years. Because of their mother had the same case and died because of that. So he had gone for the screening, and now he is detected as a stomach cancer patient. So what kind of herbs we can do, use at while we are using herbs, it will sometimes totally heal in early stages of cancers, then reduce the side effects of the cancer, sometimes minimize cancer associated complications. Lot of herbs we can use, sometimes as medicine, sometimes as foods. This much lot of herbs we can use. Then especially we have to see what kind of apatya ahara we have to stop. So processed meat, red meat, alcohol, dairy, fried foods, overcooked foods, salted fish, sugar drink or non-diet soda, then fat food or processed foods, then sweet biscuits, flavored milk, and fizzy drinks. Then what kind of apatya we have to stop or avoid. Then stress, smoking, alcohol, day sleep, postponing natural herbs, then excess carbohydrates, proteins, oily foods, heavy foods. Then drink plenty of water. That must we have to do. Then take meals, not take at regular times. Then excess weight, that means we have to prevent from the obesity. Then not taken regular exercises. And night sleep, not at 10 to 4. Especially we have to sleep at that time. So these are the natural foods good for cancers. That means mostly vegetables, fruits, cereals, likewise. So what are the good foods or patya ahar for them? Especially fruits, Indian gooseberry, then berries, pomegranates, grapes, etc. Then baby jackfruit, bitter gourd and broccoli, red onion, green tea. Then small fish rich in omega fatty acids. Then Indian ginseng, red spike thorn. Then Catharanthus roseus. In Sri Lanka, they are mostly uses this Catharanthus roses as a drink while they are having any kind of cancers. Then in citrus foods, if you take, they will prevent esophageal cancers. Then whole grains, they will prevent colorectal cancers. Ginger and mulati prevent gastrointestinal and esophageal cancers. Then turmeric, that is prevent colon hepatocellular cancers. Actually, according to my experience, a lot of patients, they are having that inflammation conditions and bloating abdomen and that infections and some other pain and lot of problems. So at that time, normally I'm asking all patients to take half a teaspoon of turmeric before night with lukewarm water. And I'm always asking to take at least 2 cloves of garlic daily. After taking it around 2 to 3 weeks, they will get reduction of lot of signs and symptoms. So hogweeds and tulasi, that is good for gastric and liver cancers. Then again, garlic and boonimba is good for colon and hepatocellular cancers. Then fruits and vegetables, 500 daily. That is esophageal and some form of oral and bowel cancers. Then what is the summary? We have to do the Nidana Parivarjana and Datavagni Chikitsa we have to do for the correction of metabolism. Then Vyadhi Pratyanika Chikitsa we have to do. Then Shodhana Chikitsa as Panchakarma we have to do according to the patient situation. Then Rasayana Prayoga, then Patya Patya they have to follow. Then the conclusion, if they take herbs daily basis as their foods or drinks, then they will heal, reduce the side effects, decrease cancer associated complications, and that while they are taking treatments, they will relieve from the symptoms, prevent from side effects, then decrease cancer associated complications. And the Patya, they will prevent the cancers and the health promotion. So this is my experience since around 7 years of a very short period. Thank you very much. Good night.
Thank you. Thank you very much. Now I would like to request Professor V.K. Agnihotri sir for his comments. Then session will be open and our respected Madan sir will guide us.
Thank you, Dr. Pawan Sharma. It's our pleasure that we got 3 distinguished guests on today cancer stomach topic webinar, and very intelligently these all 3 fellow provided lot of information with their proper and great presentation. As
within time, it is also important.
And this is one very important. I am surprised to know that the speakers with their all intelligence paid full submission and within time. Definitely within time, and we have got next 15 minutes to discuss and to wind up. So as far as Aishka is concerned, she belonging to homeopathy section, and very intelligently she touched the Ayurvedic section also, having a great support that Ayurveda has got the dietary instructions along with her contribution from herpathy. So very naturally there are so many sectors. I surprised to know that there are so many sectors where the patient can be given relief by using or providing or prescribing the homeopathic medicines. I do hope that not to go for chemo or radiotherapy, if a patient reaches to homeopath, say within time or in an early time of diagnosis, he may be having much more chances and scope to treated with the homeopathic medicine. So her contribution is very, very important. Simply one thing which she underlined, that acetic acid. That acetic acid itself in the low potency of 30 potency will work a lot if patient reaches within time. Though, as we know that in homeopathy, the same cause and the symptom, and that is the treatment itself. It is acidity there, of course, with the hydrochloric acid in the stomach, and they are treating with the acetic acid. So really, it is eye-opening how miraculous this pathy is. Of course, our second speaker, Dr. Rajushri, she was belonging to our Ayurveda section, and of course she is a Chalakya professor. So she very confidently proliferative and where the surgery is needed, and on the other hand where the palliative treatment can be given very intelligently with the types and possibilities of this treatment. She touched, and so goes the case with our Madam Dr. KCP Gunaratna from Sri Lanka. She most authoritatively, as she always does, she made all the most important informations along with the side affected, mean the organs where your Madhuvashti or your Tulsi or Punarnava will work. This is very important. Categorically, if we know that this is the stage of the patient's then we can do a lot and to help the patient. So this is my simply a coverage or remark summation on all these three our dignitaries, distinguished guests. Now we do hope that our a few good scholars like our, especially I am seeing Professor Beena Reddy. She is wife of Dr. P. Sudhakar Reddy, and we do remember that she has not only done a lot of work on stomach cancer or cancer patient, also contributed last year on this topic, I think. So she is very much here, and it's my pleasure that I just noticed.
I am unfortunate, sir. All
Thank you,
speakers
sir.
are not
Yes.
viewing our 1 minute, sir. All respected speakers are not observing our plan of the month. Otherwise, we would like to have their
Definitely.
blessing also if they propose their names. Because I am circulating that program before 5 days of the month. But whoever is contracted, then they are here.
But sir,
जो
but sir, it is,
आ गया सो अपना है, नहीं आया तो सपना
but
है.
sir, it is still a pleasure that Dr. Beena is here, and definitely she will contribute.
Definitely, we would like to listen, sir.
Yes.
With
With no wasting of time, we will like to call that you please voluntarily come so that our good strength was there. It was almost 35 or so. So, Dr. Veena, I would like to have your good comments and command.
Just a sec, sir. Please allow me. Please allow me to circulate.
Sir, through
Yes, yes,
Professor Pawan Sharma ji. Yes, sir.
Ji, sir.
Sir, thank you very much, sir. I too remember the last year I could able to contribute to some to you in this webinar. And today I was listening to I think the first one I missed, and the second and third one I was listening, and it was a very fantastic presentation, especially from Rajeshwari, who is very young and emerging, and a very confident presentation from her side. And she was quoting about Dr. C.P. Matthews, the various treatment, the modalities, wherein I have witnessed Dr. C.P. Matthew also in a seminar who was some 4 years back, and who was very confidently doing the Ayurvedic therapy. He was promoting a lot actually. So even I just wanted to share one a patient of rectal cancer here actually. So of course, because it is a GIT related one. So that the patient was
We are focusing on stomach cancer, madam, today.
Okay. Sorry, sir.
We would like to humbly request you, as Sudhakar sir is supporting us, we would like to request you to support and read carefully our program of whole month. This is our humble request, madam. And
sir, it was because of the very hectic schedule. We could not able to make you because it was on cancer today. I am
ready to change the time, madam. I am ready to change the time. I will change the time from 9. Don't worry.
Yeah, thank you very much, sir.
Thank you very much, madam.
Yeah, sir. Thank you, sir. Thank you very much. Yeah.
Now I would like to request. I would like to share our 2 great steps. Number 1, 499th webinar on 24th. Dr. Ashok Thakur, Dr. Raghavendra Dubey, Dr. Ritu Kapoor, Dr. Manoj Kumar Adalkha, and Dr. Akhilesh Bhargav will guide us on safe and effective antimicrobials, because on that day, World Antimicrobial Awareness Week is there. So we are celebrating that particular week. And 500 webinar, we were planning to this 500 webinar will come at our great event, but on 24th Netherlands Day is there. So we have invited 5 experts from Netherlands, scope and practice of AYUSH in the Netherlands. So that webinar will be on from 7th, 7 p.m. and this webinar, Netherlands webinar, will be from 9 p.m. So please do join. And our 501st webinar will be grand webinar with 51 experts, top dignitaries. Along with, we are trying to invite Mahendra Manjapuraji, our health minister. I don't know how much I will be success, but definitely that will be a grand webinar. Please do join all webinars. This is my request. I would like to humbly request Professor Madan Thangvelu sir to lead the session, sir. Welcome, sir. You are mute, sir.
Pavanji, it's already 10:37 there. And I don't know if we should continue longer, but I just want to congratulate all our speakers today to have taken us into several details. The presentation on homeopathy, we learned so much about at least one case in some detail. There is much more that we can all learn. Yashika, I hope you will join us again in future webinars just to guide us, not only with the cancer aspects, but all the other areas. And you have a lot of clinical experience, and we particularly want to learn more on the clinical side. I put one reference here in the chat box on homeopathic approach for the treatment of cancer. It's from the Indian Journal of Research in Homeopathy. There are many references in that journal which point to management of metastasis in cancers using homeopathic formulations. So that is something we want to learn more about. Rajeshwari ji, very grateful for your wonderful presentation. Thank you for pointing to late Professor C.P. Matthews' work, and also this management of inflammation. And this is an area where Ayurveda has a lot to offer, particularly in management of Helicobacter pylori. There's a lot of information available now, particularly use of ajwain and ajwain-based procedures. Perhaps you know about this already, but we will discuss this about this offline. Before I put the floor back to, and thanks to Professor from Sri Lanka, thank you so much, because that connection with what you are doing, the clinical work that you're doing in Sri Lanka, and what is of interest for the Central Council for Research in Ayurvedic Sciences and the ongoing discussions with the National Cancer Institute, there is something that we would like Sri Lanka, perhaps also Bangladesh, to come into our discussions in the future. And before I put the floor back to Pavanji, just the missed opportunities in cancer. And this is seen here on this one slide I just want to show. If you see here, this is a improvisation on an image that comes from this small company called Cellmax Life. They're based in California. Much of their interest is around on the right-hand side of this blue line. And they're interested in looking at how to detect early steps. While Ayurveda has a very deep understanding of aspects that sit within this blue box here, the transition from normal epithelium to abnormal epithelium. Clearly, this is for colon cancer, but something similar happens in stomach cancer too. Now, Ayurveda understands this. The language of Ayurveda is very rich to understand this space. And our Kriyakala, Shad Kriyakala concept provides a very, very amazing understanding in this space, transition from normal to abnormal, and then the reversion. Possibly that is what happens in most of our bodies. We are perhaps going from that normal tissue type to an abnormal state, and then shifting back, and Swasthavrit and some aspects of dietary messages that come from Ayurveda are going to be very, very useful for this. Hence, here in Cambridge, we now have something called the Early Cancer Institute. There is a whole institute looking at early aspects of cancer, the early stages. Now, much of how Western medicine looks at these early stages of cancer relates to what you can see with your tools and with your with whatever approaches that you have. But sometimes the stages of cancer and the transition is well beyond our understanding using tools and techniques that we have. Hence, this emphasis on a whole institute looking at early cancer. And listening to Rajeshwari ji today, I got this feeling that there is an opportunity for a dialogue between Ayurveda, AYUSH systems, and institutes and initiatives like the Early Cancer Institute. I look forward to discussing this as we go along by email or by WhatsApp exchanges, Rajeshwari ji. If you would like to comment on this, I'll be happy to hear. But my belief is that Ayurveda's Kriyakala aspects has many opportunities, especially Lakshana Shastra, understanding Lakshanas of the Purva Roop, and all these things. These are things that you are familiar with. You think that way, you know. While modern medicine doesn't have the language, it doesn't have the grammar to think about Purva Roop and Lakshanas and the interaction between dhatus and all these things. They don't understand this. So I see a huge opportunity, particularly in that space for early cancer. Thank you, Rajeshwari. I don't know if there is time enough. If you would like to comment, I would love to hear. Otherwise, we will follow up on by email or by WhatsApp calls. Thank you.
Pawan sir, can I have 1 minute?
Sure.
Yes, sir. As you told, as you mentioned, absolutely, we have chances in that. According to that picture, where beyond the blue line, we have a lot of scope, and even everyone is concentrating on. Excuse me. Everyone is concentrating on the treatment of cancer survivors. Usually, we are integrating in that sector most of the times. But I would say that with this lead, we can move with the pathology and in preventive aspect also, in early stages, in curative aspect also, we can get into the research works, because it takes a lot of time for me to understand this kind of concepts. It took nearly 5-6 years to come up with the idea. So when we work together, that will be possible, because instead of going in the other side, like if their patient is having a sleeplessness, we are giving treatment in post-radiotherapy treatments. Instead of that, we can skip to the first part. That will be good. And the modifications which we can make in their lifestyle and also understanding the pathology at the basic level is most important here, I feel, sir. That we can go with that.
Thank you for adding. I just want to highlight here Professor Rebecca Fitzgerald. She is the director of the Early Cancer Institute. I'll put this in our discussions. Now, Rebecca ji, she has developed something called a sponge, a cytosponge.
Yes.
Basically, what happens, the person swallows a little sponge, and then that sponge is pulled up, and you can actually see all the transitional stages in these cells. And because we have such approach now, it becomes very easy to come up with that the effect of those Ayurvedic interventions that you showed today, particularly those valuable list of aushadhis that you have, you know. Okay. And so it becomes very easy to, I'm saying it becomes easy to open a dialogue with them, and let us see how it goes. So this is my assessment and suggestion here. And perhaps with people like Pavanji networking across India, we'll be able to have some kind of a center of excellence or some kind of an interactive initiative that will then help us connect with the ongoing thinking in America, and also a lot of ongoing thinking here in Europe and with Japan also, because they are the big players.
USA and Europe persons are not involving independent research ethics society. So that is not...
they won't, Pavanji, let me just correct
just
here.
Just a sec, sir, because 11 is now coming, and I would like to focus on audience discussion also. If anybody has any experience on stomach cancer, please share. Only focused on stomach care. If in an audience We have Dr. C.P. Sharma ji, Dr. Swati, Jagdishwar ji, everybody. If you have any experience on stomach cancer, kindly share. Focused on stomach cancer, no general talk.
जी नमस्कार.
Namaskar, Sharma ji, namaskar. Focused on stomach cancer, sir.
पवन जी नमस्कार.
Pranam, sir, pranam, sir.
हाँ, मदन जी, अग्निहोत्री जी प्रणाम. जैसा कि आप जानते हैं, शासकीय आयुर्वेद महाविद्यालय ग्वालियर के पास ही, तो ये हमारा
Your voice is discontinued.
आवाज नहीं आ रही.
समझिए कि कैंसर में जो ट्रीटेड होते हैं कभी कभी, चूंकि CRI भी हमारा है, मैं आपके साथ शेयर करना चाहूंगा. इसमें मैंने सर प्रयोग किया, जैसे विस्मय है और भांग है, क्या माइन्यूट गांजा और शुद्ध भांग का गुड़कते समय पेशेंट की
सर आप वीडियो बंद कर दीजिए, आपकी आवाज नहीं आ रही है. आपकी आवाज नहीं आ रही है सर. आप डिस्कनेक्टेड होकर इंटरप्ट आवाज आ रही है. आप वीडियो बंद कर देंगे तो शायद आवाज आएगी. नेट आपके यहाँ कमजोर है सर.
गौ ग्रह
आप मेरी
अब आ रही है सर.
आप वीडियो बंद कर दीजिए अपना.
यस यस यस, जी जी जी.
आप म्यूट है सर. यस, काइंडली कंटिन्यू.
हाँ, तो उसमें सर जो अनुभव रहा मेरा, या जो इस तरह के केसेस थे, उसमें गौ दुग्ध जिसमें लगभग अभी जितनी भी साइंटिफिक वो हुए हैं एवोल्यूशन, उसमें लगभग 600 एमिनो एसिड्स कैंसर रोधी पाए जा रहे. ऐसे ही सेलुलर लेवल पर हमने कुछ प्रयोग किए जिसमें पेशेंट बहुत ज्यादा परेशान था. तो सेलुलर लेवल पे हमारा गिलोय पुनर्नवा और जैविक आंवला मुलेठी, क्योंकि अभी सभी जितने भी हमारे वक्ता थे उन्होंने अपनी प्रस्तुति में दिया ही है कि आम्लकी रसायन, मुलेठी रसायन, शिलाजीत रसायन, तो जो यदि हमारा अच्छा अभिपत्तिकर भी होगा वो भी हमें अच्छे रिजल्ट दे देता है. तो हमारे साथ एक और संयोग है, शासकीय आयुर्वेद महाविद्यालय से एड ज्वाइनिंग हमारी फार्मेसी भी है सर. तो कई बार हमारे को अच्छा अभिपत्तिकर चूर्ण मिल जाता है कंपैरेटिवली मार्केट, तो उसमें भी हमें बहुत अच्छे रिजल्ट हैं. कई पेशेंट, जैसे हमें मुलेठी देना है या मुलेठी रसायन बनाना है, मुलेठी में मुलेठी की भावना देना है, तो हमारे जो फार्मेसी सुपरिंटेंडेंट है उनसे हम ये कुछ ऐसे कीमो के बाद आता था या कीमो के जाता था, डरा हुआ रहता था, तो उसमें हमने पश्चात केसेस में गौग्रत, गौदुग्ध और मुलेठी आम्लकी रसायन का और अभिपत्ति करके अच्छे रिजल्ट देखे, जिसमें पेशेंट को सुकून मिला है. ये कह सकते हैं कि उसको जो बहुत ज्यादा इरिटेशन होता था, जो उसके बिल्कुल काला हो जाता था, बाल झड़ जाते थे, उसमें रिजल्ट अच्छे आए. तो यदि इसके ऊपर एक प्रोजेक्ट तैयार कर, भले ही अभिपत्ति कर का लिया जाए, मुलेठी का लिया जाए, तो एक अच्छा आमाशय के कैंसर में परिणाम देखने को मिल सकते हैं, आयुर्वेद के लिए आशातीत. और जो मेरा अनुभव रहा उसमें एक मैंने भस्म बनाई थी, उसमें शिवार्पित जो भी, चाहे वो धतूरा हो, चाहे बेलपत्र हो, बिल्व फल हो, जितने भी पुष्प वगैरह समर्पित होते थे अचलेश्वर महादेव पर, वहां से हमने उसको कलेक्ट करवा के गौ उपले, गाय के गोबर के जो कंडे होते हैं उनके साथ भस्म बनाई। उस भस्म को भी हमने कुष्मांड अवलेह में चटाया, तो उसमें अच्छे रिजल्ट, उसका गैस्ट्रिक इरिटेशन कम हुआ।
एक्सीलेंट सर।
ये छोटा सा अनुभव रहा सर, क्योंकि कैंसर
धन्यवाद
हॉस्पिटल
सर, बहुत
एडजॉइनिंग
बहुत
रहा हमारे
धन्यवाद
साथ।
आपका,
कुछ
बहुत बहुत धन्यवाद जी सर। और कोई बोलना? डू यू हैव पटनगर साहेब, डू यू हैव एनी एक्सपीरियंस ऑफ स्टमक कैंसर? ओनली ऑन स्टमक कैंसर?
यस यस, एक्सपीरियंस देने इतना बड़ा तो नहीं हो, पर अभी भी मेरे ख्याल से इतना कैंसर के बारे में या कोई भी जो ऐसी बीमारियां है उनके बारे में जो पब्लिक अवेयरनेस चाहिए, वो अभी भी मेरे ख्याल से अपने इंडिया में नहीं है। तो इसके लिए सभी जो स्पीकर्स थे उनको पूरा नहीं सुन पाया, पर
आपका कोई अनुभव है क्या स्टमक कैंसर पे सर?
स्टमक कैंसर में अनुभव इतना ही है कि जैसा अभी शर्मा साहब ने कहा कि गोघृत और यष्टि मधु इसका उपयोग करता हूँ, पर बहुत सारे केसेस तो नहीं देखे हैं, पर मेरे ख्याल से पब्लिक अवेयरनेस इसके बारे में जो भी पहले दो स्पीकर्स ने कहा वो उतना ही जरूरी है। पर गोघृत और यष्टि मधु ये दोनों, और उसके बाद में जब भी केमो वगैरह लेने के बाद ये जो 3 सूक्ष्म कल्पना जो देता हूँ उसके भी रिजल्ट्स बहुत अच्छे हैं कि उसमें हीरक भस्म, सुवर्ण भस्म और अभ्रक भस्म ऐसे पेशेंट्स को दिया हूँ। ज्यादा अनुभव तो नहीं है, पर 1-2-3 पेशेंट्स में।
थैंक यू सर, थैंक यू वेरी मच। If anybody would like to add anything on stomach cancer, welcome. If anybody, any expert from the audience would like to add any experience on stomach cancer, we would like to welcome that. But focused on stomach cancer. I hope there is no experience. Any expert would like to say anything on stomach cancer? If he has treated, he or she has treated any stomach cancer cases? I don't hope so. I don't hope so. Because cancer patients are generally not coming to Ayurvedic doctors. This is also the problem. So I would like to request Professor V.K. Agnihotri for his valedictory remarks.
Thank you, sir. Thank you, Dr. Pavanshamaji. As per your repeated request and appeal, I found that most of the information available with our speakers and our spectators have already been made available to our webinars platform. So thanking all the persons, especially our distinguished speakers, I think today's webinars has got a very, very good information from homeopathy, from Ayurveda, and on experiment basis with the treatment part with our Gururatne ji, Rajeshri ji and Yashika ji, along with our Professor Madan sir ji, Padankar ji, sir, C.P. Sharma sir, all the discussions came to one focus that food habits should be taken care of along with some the public awareness. This is what the extract of this thing. If the food habits will be all okay, most of the time we will be in position to prevent such type of deadly disease. Thank you so much. Over to Pavanshamaji. Thank you, sir.
Thank you. Thank you very much. Thank you all. Thank you, Madan sir. Thank you, Agnihotri ji. Thank you all the speakers. Thank you very much. I'm sorry that we could not discuss because after 9, only focused discussion will be welcomed, not beyond or surrounding the main topic. So please excuse me because I am following Ayurveda in my life. I am just sleeping at 10, 10:30 and awakening or 3 a.m. So
अभी तो मुंबई में है सर, तो इसके लिए
at present I am in Mumbai. Thank you, sir.
But pleasure is that still we are 14 in number at closing time, which happens rarely. Still we are 14.
Right. So I will change the time, sir. I will sacrifice the sleep. Don't worry, sir. Don't worry, sir. Oh, no way out for me. No way out. It is really hard fact, sir. You are mute.
यहाँ तो 5:30 बज रहा है.
Regarding the issue, webinar certificate, one of our participants was talking about the webinar certificate, so you can make a information in this way. Previously, we were having the
Sir. I am circulating webinar certificate template to everybody in groups. So if anybody has, I will circulate to you also. So you can also give them. And I am circulating in groups so they can make any number of certificates they want.
Yes, sir. Yes, sir. This was asked repeatedly to some of the our participants in that way. Is there any certificate will be provided to attending the webinar? This was from Rekha. Some Rekha was asking.
Rekha Sharma ji is audience only.
Yes.
I hope. No, I was circulating to speakers.
Okay. Yes. That's why I could not.
I will send you the link also. And from next time, definitely, I would correct myself and would provide the link in chat box.
Okay. That's why I could not answer her properly and could not make any information available in chat box. Anyway, you will get afterwards. Okay. Thank you, sir. Thank you. Namaskar. Shivratri, Naman, sabko pranam.
Good night.
Good night.
Madan sir कुछ बोल रहे थे.
Yes, sir.
यहाँ तो 5:30 बज रहा, अगर चाहे तो
आप तो एंजॉय करिए. ये 11 बज रहा है.
हाँ जी, 10-11 बजे तक चल, अगर आप चाहे तो we can keep it going till 11 बजे.
बहुत चीज़ें
only 2 minutes are left, sir.
बढ़िया जी.
Only 2 minutes left in 11. Thank you.
धन्यवाद. शुभ रात्रि.
शुभ रात्रि.
सर्वेभ्यो नमो नमः. सभी को प्रणाम.